Thanks for waiting just a couple of minutes while we got some of our stuff situated here. So we'll go ahead and, well, we don't really have to, we'll call the meeting to order. So tonight we are discussing the school-based healthcare center. There's currently one at Central High School, and there's the proposed one at the new Grand Junction High School. So with this meeting, we, since it's been a few years since the previous board had this conversation, wanted to have this board be brought up to speed with those conversations and be able to ask questions, bring the community along in this discussion. Obviously, prior to this board, there's obviously been a lot of things that have happened locally and nationally. So it's just, I think, prudent to come back and have this conversation, pros and cons. So that's the purpose of tonight. I know we have some information that we've brought together from the previous needs analysis that was done prior in 2017, 2018, and is that when? Okay, in 2018, yeah. And so we'll bring all that information together. So there's not going to be any public comment tonight. That does not mean that if you need to catch one of us afterwards or send an email with any other thoughts or questions that anybody has, please do. There will be public comment at the business meeting next Tuesday. So if you want to, formulate anything, I know we've received a handful of emails today. And so I do have some of those questions that were proposed in some of the emails that we received that we could look at addressing. And so really this is for the public to just listen to the board, hashing out this conversation. And so instead of I know our board meetings go long, we opted that we would offer a special meeting to discuss this particular topic with each other and obviously have the community here as well. So if any particular, I don't know if we want to start looking back, maybe we should just look back at what was presented in 2018 with the needs analysis. From our last conversation and our workshop, it was proposed that we potentially have Marillac or the community do another needs analysis, but then after further thought, we're not sure whether that's a good use of time and money, because really the needs analysis is there for the students. That's already been done, and they did all the focus groups and all that information. We may end up just replicating information we already have. Really what this is about is bringing the community along to see what the community feels around having the health clinic in Grand Junction High School. And I think also clarifying questions or concerns, whether for or against, that we've had expressed to us from the community. So we're going to hash through some of those tonight. I encourage every board member to please express this. I want this to be a good, healthy discussion between all of us and, kind of what we're hearing from people and bring up different, questions or thoughts. And so I just want to engage the entire board in the discussion. So do you want to, you have some stuff up? Okay, perfect.
If this is what the board wants us to go through, I sent this to everybody in December. It's the presentation that was given. It looks like it was actually January 2019. So the folks that were giving the presentation at the time, some of our staff members, they're retired, and so they're not around anymore. So we can go through all the slides if you want and review it, or whatever the board would prefer. You think that's good? Okay.
I think let's look at this information, making sure that all board members are, again, on the same page with the same information. We can stop at any point if board members want to, ask a question. I know Marillac is here if they need to ask questions or answer any questions. And we also have facilities here, because if we're looking at making the change of what's on the plan, so, that the board could understand or get some information on what that may look like. So we do have some people here that could potentially answer some other questions for us as well.
So I will try to recreate the presentation from like 4 years ago, but,
The good thing about this,
yeah.
though, it gives us all kind of a baseline grounding, and so we have defined terms, so when someone says something, we can all know that's what that means,
Okay.
instead of just making some assumptions. So I think to go through that this is good.
So this first slide is really just a definition of what a school-based health center is. So a school-based health center is a health care facility located inside a school or on school grounds, staffed by a multidisciplinary team of medical and behavioral health providers, sometimes dental professionals, health educators, and health insurance enrollment specialists. And the purpose is to improve health and education outcomes. So who is served? Students who have barriers or challenges to accessing care or is limited. Services are designed to identify problems early, provide continuity of care, and improve academic participation. And also, just kind of a side note, I know there were some questions from the board about whether or not the current one we have at Central serves the community, and that is not open to the community. So the one at Central High School is just for the students at the school, and I believe if we were to move forward with the one at Junction, it would just be for students within the building. So those are not open to the community. I think there are some school-based health, actually I know there's some school-based health centers in other places that are open to the community, but ours currently isn't. So this slide, it was a difference, well, the logo's covering it up, but there was a difference between what a school-based health center can do and what a school nurse can do. So I won't read all those, but you can see them there on the screen. Okay. Maybe I'll go after you go if I move on. Okay. So the outcomes for school-based health centers: increased immunization rates, decreased use of emergency rooms, improved screening and identification of students at risk for depression and/or anxiety, improved screening and early intervention to address risky substance use, decreased teen pregnancy, improved identification and screening of overweight/obese students, and improved educational outcomes for better school performance, grade promotion, and high school completion. Those would be the goals for having the school-based health center. So back when there was a committee that was put together in, I believe, 2018, these were the members that were on that committee. So it was some D51 staff and then representatives from different entities throughout the community. So you can see the names there. So the objectives of the needs assessment that was done, and my understanding is the needs assessment took, I can't remember, it was 4 to 5 months to complete, and this presentation will go through kind of what they did during that needs assessment, but the goals were to understand the healthcare needs of students in the target areas of Mesa County, Valley School District 51, assess the potential utilization of a school-based health center, and then understand existing community resources, including healthcare facilities that serve low-income children and youth, and identify barriers to students receiving services. So they had student, parent, and staff surveys were conducted, and it looks like they had about 1,300 respondents to that. There were also focus groups that were conducted, 55 participants in 6 different focus groups, community partner interviews with 4 different organizations, and then they used existing data for health and socioeconomic indicators. And then you can see the target population over here to the side. The analysis focused on students enrolled at Central, Grand Junction High School, and their feeder middle schools. The CHI, the Colorado Health Institute, found that both high schools met key indicators that project the need for a school-based health center. Those were health outcomes, access and utilization of care, health insurance coverage, and youth risk factors. So you can see the respondents by stakeholder group, student survey respondents representative of the district student population in race and ethnicity and gender, Spanish-speaking parents, male parents, Central High School parents, and Central High School parents are underrepresented in the survey. So mental health was the most critical student health concern. The top 5 student health concerns for students, you can see them on the screen: feeling worried or stressed, feeling sad, eating and weight issues, suicide or wanting to hurt themselves, alcohol or drug use. For parents, feeling worried or stressed, violence and bullying, feeling sad, not enough exercise, and eating and weight issues. And then for staff, it was anxiety and stress, alcohol or drug use, problems at home, coming to school hungry, and eating and weight issues. Top 5 health complaints or chronic conditions that affect students' attendance and academic achievement. So emotional issues were the number 1. Sore throat, colds, fever, earaches, and coughing. Behavior issues, stomach aches, and headaches. So health insurance coverage for the county. So at that time, D51 ranked 80th out of 178 school districts for percentage of school-age children in poverty. The percentage of school-age children living in poverty in District 51 is higher than the statewide average. Mesa County has a higher percentage of uninsured children than the state, I believe that's supposed to say. The percentage of children enrolled in Medicaid is higher than the statewide average, and the percentage of children eligible for CHIP Plus is double the state average, leaving an estimated 2,243 children who are eligible but not enrolled. You can see the statistics on there for the county versus the state. Access to care. So most parents and students report that they, youth, have seen a doctor and dentist in the past year. More than a quarter of parents and students report that they have seen a mental health therapist in the past year. And you can see here 6% of parents reported that their child does not have health insurance, 17% have Medicaid, and 9% have CHIP Plus, and then 40% of parents believe there are not enough places to get health care. And then you can see the percentage reporting student access to care up there in the top right corner. So I won't go through all those. Percent of parents avoiding / delaying care due to barriers. So the barrier, lack of time, and then the percent of surveyed parents avoiding delaying child health care. So 32% mentioned lack of time, 33% mentioned cost, and 10% mentioned transportation. And then these were questions around for students' view, the students' use of a school-based health center. So how many of them would actually use it? The parent view for student use of the school-based health center, and then staff support for it. So you can see the percentages there. It looks like the last one didn't have the percentages on it, but the staff one was the larger one. Was I think it is a good idea, and I'm supportive. And then you can see for parents, for definitely use 24%, 32% said probably use, and then 28% neutral, and then 7% probably not, and 9% definitely not. And then for students, 11% said they would definitely use it, 23% said they probably would, 36% were neutral or don't know, and then 20% said they probably wouldn't, and then 10% said that they would not use it, definitely would not use it. School-based health center use and support. So you can see with the answers here, these are, I believe these were questions around whether or not they would access the school-based health center for these services. And I'm going to actually look back because I think Marillac maybe, is that what those questions were? It was whether or not they would actually utilize these? Okay. Yeah. So you can see that on there.
Do we have something like this for what was actually used?
So I have two documents that I can think of right now. One is it shows over the last 3 years the amount of the services that were utilized at the central clinic, so we can pull that up if need. And then we also have one that's a little bit more detailed that breaks down within those categories, like what were those services that students utilized. So I can pull that up if the board, do y'all want me to pause and pull that up now?
No, sorry, you can finish.
And then pull that up? Okay. Write that down so I don't forget. Okay. Common questions and concerns for operations, it was around staffing, quality and experience, location, where and transportation, hours, operating hours, non-school days and hours, and then services, what services are being offered, coordination with outside providers, and then cost. For parent involvement, communication, parent knowing child was seen or being present, confidentiality, child receiving care without parent knowledge, understanding who has access to medical records, and creating space where kids can receive services confidentially. And then for funding, the cost to operate, how it will be funded, not wanting education dollars shifted to healthcare, and then sustainability, close if not funded long-term, options to fund long-term. So those were some of the questions and concerns that came out of those surveys and then the meetings, I think, with the focus groups. Recommendations from the group was that community input indicates ample support to pursue a school-based health center in the district. Mental health and substance use are a clear priority area, to develop a communication plan to reach stakeholders, and then school-based health center operational policies and procedures can address feedback from staff, students, and parents, and address potential concerns. So again, this was back in 2018. These were the recommendations that were made. And that's the last slide on that one. So let me pull up, unless anybody has questions about this one before I close it. Let me go back. So I can try to answer these the best I can. So staffing, and yeah, maybe Marillac might want to help chime in if I mess this up. But staffing is all they're the folks that work within the school-based health center at Central currently are not D51 staff. They're staffed by Marillac, and that's funded through Marillac. So we're not actually spending D51 funds on that. Location, obviously, at this point, we have a Central High School school-based health center. I think based on the documents that I've shared that we found, and then also just conversations that have happened over the years, that the assumption was that the next location would be Grand Junction High School. My understanding is that actually Grand Junction High School was identified as the #1 for need, but at the time there was a concern about putting money into the infrastructure of that building, knowing that it needed to be rebuilt at some point. So Central became the target. Operating hours is during school hours, and again, it's not open to the public. I don't have the exact hours, so Marillac could possibly provide that for us. And then we do have a list of services. I can pull that slide up and go through all the services there. Like I said, cost, all the equipment at Central High School, the staffing, everything is done by Marillac. I think the only thing that we provide would possibly be custodial when they're cleaning the whole building, but I could even be wrong about that. And then obviously if it's part of the building, there's some energy costs, but that's pretty minimal compared to the rest of the building. So communication, parent knowing child was seen or being present. We have another slide that I can bring up that talks about legally what services that parents have to be notified about, and then what services that's not required over a certain age. So we can pull that slide up, because if I try to remember it by heart, I'll butcher it. And that goes into the confidentiality one as well. I kind of mentioned cost to operate, that there's grant funds that are paying for this through Marillac. And then sustainability, the Central one's been open. This is the 3rd year, I believe, it's been open at Central. So, all right, any other questions about this presentation before I close it out? Okay, let me pull up, I think to answer your questions, Dr. Schultes, I'll try to find the slide for where the service is being offered currently. So this was a document that was shared last time, and so I'll pull this up and try to make it as visible as possible. I think I can zoom in down here. It's fun when you extend your display and you can't see what you're doing. There we go. So these were provided last board meeting, but these are the past 3 years, the main services that were being provided at Central High Schools. So you can see in each years column, you have two columns. One is the number of users that utilize that service, and then the number of visits is next to it. So the first year, you can see medical, 290 users, and there were 613 visits. Behavioral health, 140 users with 441 visits, and then dental, 36 users with 41 visits. And then you can see that going on through the years. So year 3, you can see it's just through December of this year. That's one semester's worth of visits at Central High School. And then,
When we have, when you have medical,
mhm,
do we have a breakdown, okay,
Yeah.
what's medical, what's behavior, what's,
so
you know what I'm saying?
I think that's this one. Let me try to pull it up as well.
So you look at that, okay,
Sorry.
that's all right.
So this was also provided to us, and I will try to zoom in. So this was a breakdown of visits, diagnoses recorded, and services by program area from August 2020 to December. So when you talk about behavioral health, this is the reasons for students visiting for behavioral health. Depression screenings being number 1, stress, anxiety, depression, trauma, tobacco, grief, self-harm, addiction, and eating disorders. And then you asked about you asked about medical in particular. I think I just messed that up.
Well, it was just a breakdown of.
Oh, there it is.
So these numbers are from the beginning of the clinic till
Opening.
December.
Yes.
of this year.
And so those were the medical visits. The main one being nutrition and physical activity counseling, BMI, common cold or virus issues, and then blood pressure management, sports physicals, STI testing, reproductive health education, immunization counseling, injuries, and so on and so forth. So back to and then you can see dental down here too. So 75 for dental screenings, 11 for tooth and jaw pain, and then 1 for injection. So back to this one, if I'm reading this right, those numbers are broken down in the other one I just showed. And you can see here just some other statistics. So less than 1% of the visits are for reproductive health visits, and then 36 to 40% are for behavioral health visits. They did a breakdown of, for the payer, for the visits, and then here's a list of top diagnoses that were that they've been seen for. So depression, anxiety, stress at home, anger, social anxiety, relationship problems, family discord, PTSD, OCD, acute stress, panic attacks, substance dependency, eating disorders, vaping and nicotine, sports physicals, and then acute cough, sore throat, headache, COVID screening, concussion, cold and virus, routine screening, STI. And it looks like top diagnosis matches the 2018 needs assessment findings from student and parent staff comments. So,
You go back,
mhm.
scroll back up. So if you look at that, we have as many in the first 6 months of this year as we did almost from the first year, so it's obviously getting more use.
Yeah.
Is that right?
If we're on track, we'd be down quite a bit from last year.
If that's
From
true, yeah.
21, 22.
And is there, when you, now go back the other way,
Mhm.
like scroll up. So when you see these, go a little further, the diagnosis, is there any, and I don't know how you'd even do it, so maybe it's a dumb question, but is there any outcomes like that these visits and interventions had or any customer satisfaction type things, you know, that it actually has been a benefit, other than checking off, we've seen this and that? I don't know, that's probably a hard one.
So I can't answer that unless
That leads me to a question I actually have. Under the memorandum of understanding, under item 13, and this is the one we have with Central. So this is under, the obligations, further agreements of the parties. Number 13 says the parties agree to design and annually execute an evaluation of the school-based health clinic processes, students' health status, and student health needs. It says both parties will identify, collect, analyze, and share data necessary to perform the agreed-upon evaluation. Evaluation results will be used to improve the SBHC's efficiency, effectiveness, utilization, and financing in order to increase students' access to primary health care. So I was just wondering, since we've had it open, if we have that.
Yeah, if you don't mind, because I'm not a part of that. So the question is, did we create did we design and annually execute an evaluation of the process, student health status, student health needs? So I guess what does the evaluation process look like for the current services at Central High School?
Well, and this is an obligation of both parties, so I'm just wondering where we hold on to this at the district level too. If you could come to the microphone too, you're all welcome to, or they can send you up by yourself.
I can speak to that part of it.
We appreciate it, thank you.
Part of it is that we have an advisory community, it's called a Community Advisory Committee or Council that meets 3 to 4 times a year. And it has school representatives on it, Marillac representative, the health department is on it, private pediatrician, so there's other folks that are on it. And so that agenda includes reviewing kind of a dashboard, kind of like what you're doing, what services, users, what utilization data, anything that's coming up, then that's usually discussed there, any, suggestions that they may make from the committee or the council standpoint. And then the principal at Central last year did a survey, a youth survey. And one of the questions on their youth survey included questions around the school-based health center. So he has all of that data, and he did present that at one of the council meetings and talked about it, what the results, what the students were saying about it, having that available to them, the benefits, the use of it, things like that. So he has that survey. And he said at that time, his plan was to do an annual survey.
Can I ask who in the district is responsible for upholding our portion of that part of the agreement? Making sure that district, that we're participating in that.
Well, it sounds like the principal is a part of that advisory committee, so.
So going back to, if you look under the obligations of the district, under the memorandum of understanding, number 4 says it's to designate the school principal as the liaison between the school personnel and SBHC personnel in planning and problem-solving issues around issues concerning the SBHC. The principal will assist medical sponsor, and medical sponsor is referring to who's running the clinic, in developing an annual budget for the operations and to include a value of in-kind support from the district. But I don't know if that's also implying that the principal is then the one responsible for collecting that data. I think in addition to student data, are we also collecting data from the parents via a survey of what they, that's really kind of what I'm wondering is what our parents are feeling as far as, and what value they're seeing with the clinic, with their students getting that health care. So
We can-
is your understanding, is your understanding only that it was a student survey that the principal conducted?
That's my understanding.
Okay. Also, on that advisory committee, I do have one question. Under further agreements of the parties, it says, this is under number 1, so the parties will jointly sponsor a community advisory committee made up of representatives of each party to this memorandum of understanding, representatives of the community at large, and the school-based health users, parents, and students. So do you also have parents and students on that?
There is a parent and a student.
Okay, thank you.
And I can get more clarity on the other question, and get back
Okay.
to the board.
Yeah, so I think we're gonna need, if we can get the survey from
Yep.
Lance on what that information was, and then if we could get, and then just clarify whether that was students only. And I think moving forward, I'd like to also have parental input or parents to be surveyed on that as well.
Okay.
Just while we're thinking of it.
So the other one that, so do you, I can go off of this and, because the other question that was raised was around services and parental consent. So I can go to that one unless y'all, there's other questions about this document before I pull it down. So let me find that one real quick. There was a presentation that was given actually to this board about a year ago. And so let me pull that one up because I know it had a slide in there that talked about here it is. There we go. So this was the presentation that was given to the board last March, and there is a slide in here that mentions, it had a breakdown of, there it is. So this is under Colorado state law, minors are able to consent to several types of medical treatment, and you can see on the left column the types of treatment, and then at what age is there consent. So I'll leave that there. But there were questions about that.
Do I have it right, though, that students, that there has to be a parental consent for students to use the clinic?
Okay, so I just want to repeat that for anybody who might be listening. So it is in the registration packet for students when they pick it up for parents to consent to the student accessing the health clinic. So, okay, and they're sent directly from DocuSign to parents. Okay,
So if you don't have that signature, then a student can't access the clinic, is that right? For anything?
For anything at all.
I'm just asking.
I believe so.
Or they'll try to get verbal consent, so if there's an urgent issue, they usually, what they've told us, our providers, is they work so closely with the school nurse. Because that's a process.
Sure.
Most of the kids go through the nurse first.
Sure.
And then she directs them or brings them over
Sure.
to the health center. So that they engage with the school nurse to be able to help with getting verbal consent, so they don't have it, and there's an urgent issue, an injury, something like that. And they'll work with the school nurse to get the verbal consent, try to call the parent,
Ju-
get them on the phone, talk to them.
So to be clear, for a student to access the clinic, there's either verbal or written consent by the parent.
Depending on what the service is, if they say they're coming in for a behavioral health visit, then it follows this.
right, so the clinic, per my understanding is, I mean, because state law is going to trump any policy or procedure that we would have, because this is law. So if a student doesn't have to have parental permission to access that service, they could go to any clinic, not just the clinic that's in the high school. They could take a bus and go to any clinic and access those services without parental knowledge or consent. That's as the law, as I understand it. Okay.
There might be a registration process that entity uses to register them as
Okay, so there could be a registration process.
So they,
Dr. Hill, were you able to get the other information that I had requested?
That was that other one that I just showed.
Okay,
It's,
because for some reason, I can't pull it up.
That's this one. So it's got the breakdown.
So I had requested from our last workshop, I had reached out to Marillac to see kind of the exhaustive list of services or that what they're required to do per their grant funding, and wanted to kind of specifically see some of that. So they were very gracious to put that information together and get it over to us. So I know it's sometimes, I don't mind PowerPoints, but sometimes I like seeing the documents themselves with the information in it to be able to read and understand what that information is. So that's what this information is.
It's in the other PowerPoint.
No, I had emailed to ask what was specifically in the grant language of what you're required to provide. So I think you provided, yes, you provide. Yeah, thank you. That's what I was looking for.
And is all that on a slide in that other presentation?
It's, I don't know how many pages long that is, but that's the exhibit from the state, CDPHE, the state of Colorado. It kind of breaks down what is that expectation statement of work for receiving funding to support your students.
Okay.
I remember this one was in one of the presentations, services required by CD, PHE and high school-based health center. So that was in that other presentation.
It's the same. This is the summary.
Yeah.
So I think one question so reproduction, health, education, and services, what is encompassed under that? Or is that detailed more in the information that was given to us? I think some of our parents, I mean, I'm guessing this could potentially be STDs, maybe birth control. I don't know what falls underneath that category. I mean, that's been one of the points that I think parents had some questions on, and then also, I think vaccinations was the other one. Do we have a?
I looked at
I don't
Marillac
know,
again
can
on that.
somebody-
I'm not an expert on.
Well, or if somebody,
reproductive
if you
health.
guys don't have it, if you could email it to us, a list of what is under reproductive health, education, and services. Thank you.
And did the previous one say that that was less than 1% of the medical services provided?
Thank you for pointing out.
Is less than 1% of the medical services provided is
was on-
reproductive.
That was on this one, right up here.
And then there was a slide before that, though, that appeared that maybe there was more than that,
More than,
the 1%.
Well, that
Seemed to be
includes,
higher.
I know what you're speaking to, that would include anything. If they even talked about it, did education, answered a question, they're recording that as part of the visit summary, so it's gonna capture that. So it's not like just an exam was done, or just a prescription was done, but it was education also.
So is that the 1%? I'm not.
So those numbers are not gonna match exactly, because diagnosis numbers, they're gonna record multiple, like, reasons they talked to a patient. They're gonna record all of those reasons, and that's what is grouped together, so you can see, these are the types of visits or the diagnoses that were recorded in a visit.
So what is included in the 1%?
Those would be actual visits by a student for, like,
It would be birth control.
an exam, could be an exam, or it could be a prescription for birth control, contraceptive.
Okay. Thank you.
Right, because a student could come in and talk, they might have a sore throat, then want to talk about something reproductive health-wise, and yeah, and I understand in medical field, you guys have to record everything that you are having that discussion with. And so, but then they do delineate out if a particular exam, service, or medication is administered. So thank you for delineating out that information.
Let me ask, and forgive me if I missed this, getting back, because this is an issue with some folks, on the parent permission aspect of all the users, right? When you have those, say this year, as an example, 436 users. What percentage, or do we have the cumulative, when you had the one, Brian, that went from 2020 to now? What percentage of users use services that have not had parent permission? Do you have something like that? You see what I'm getting at?
That's a good question. And if you're relating back to reproductive.
Well, no, I'm just as a whole, well, whatever requires, there are some things that don't require parent permission. There's some things there you said do, so that's off the table, we know they do. But the ones, yeah, out of the whole picture of users, how many, what percentage makes up they didn't have parent permission. You know,
So if you're asking for a hard number, we don't have that, but we can certainly get that.
okay, only because it answers a question that we get inundated with, and like the 1%, that's,
Right, so basically,
that's-
anything on the state, anything on that chart that a child can see, someone without parent permission, we just need those broken out by what services the clinic is providing and what percentage of that falls under that category. I'm sorry.
We can tell you on the medical side, it's 99% have parental.
okay.
Okay,
That-
on the
that's
medical
fine.
side, 99% have permission.
No health services shall be provided to the child under 18 by the medical sponsor or subcontracting organization without prior written consent of medical services.
It's the BH1, that's why we're hesitant, because the BH1 has a lot more stipulations around
Okay.
parental consent. That's where we'd have to dig deep.
Only to get context of, as that comes up, so we can answer with facts and not just what we think or what we hear somebody says it is. You just, I'm saying, so.
But also, we can rest assured that no health services are being provided without parental consent. No medical service is being, yeah, unless, except in the case of an emergency, a life-threatening emergency. Yeah.
And even in the case of an emergency, we'll make every attempt to contact the guardian, the parent.
Okay,
If we can't, we just take care of the emergency.
great point.
But just to clarify what you requested, we're looking for total number of users, numbers who are getting services without minor consent, and what are the reasons that they are not, they had a visit under minor consent. I'm assuming that's the data you wanted.
I think that's it. I think it's just to have a better understanding of this, how widespread is it? I think there's a notion among some that it's just, and I could go in and get anything done, and, well, no, but that's what people believe, right? And I want to dispel, if it is, can be dispelled, what actually is happening, so we have facts over perception or what people think. Because I don't know what that is, okay.
So one question I have, and you guys are probably not gonna be able to answer it, but, I'm trying to figure out how to find out more information on this. The school-based health clinics in other states, some are going way further than I'm comfortable as a parent. And I know some of that is coming down from legislation from those states. So, we're in this board role for a period of time. And obviously, we've all even inherited problems and decisions that have been made from previous boards. And so the way I'm trying to approach this is not only thinking of what's going to happen the next 3 or 4 years, but what ramifications, good or bad, are there in, 10 or 20 years down the road? Because I think we all know that there can be things that are presented at a certain day and age that you're saying, that you're like, this is good, I agree with these things. But then legislation changes, governors change, state house changes, state senates change, and then the rules start to change. And now all of a sudden, like I said, I think last time at the workshop, is once the toothpaste is out of the tube, you really can't, it's hard to get it back in. And so I really want to think long-term, what happens if things change in the state of Colorado to, the further, I guess, undermining of parental rights with their kids. I mean, for instance, in California, I'm just gonna say it, they can get gender-affirming care, and I'm not saying that I'm for or against it. What I'm saying is the parent needs to be involved in the discussion. Doesn't matter what my personal belief is around it. The role of the school board is to make sure that we are team members with parents, students, and our staff. And so parents are getting frustrated because they feel like their decision-making processes or just the decisions they want to make for their kids are then getting undermined because a student may have a thought about wanting to change their gender.
Can I
and
just
this-
say really quickly, California law requires parent or guardian consent for gender affirming care for minors. They cannot do that without parental consent.
Right, well, that's great, that's helpful. I just want to make sure that we are not getting ourselves into the situations where we hear some of these other clinics, coming about, doing things like that.
So,
And I need to get some more information because have on good authority students getting that without parental consent. I think that's probably more of a staff administration issue, probably in some of those districts, rather than it being the state law, so.
just to, in agreement with what you said, I'm not so concerned about what the rules are today, but I am concerned about where the rules may go. And it may not even be 10 years down the road. It could be next year. It could be it could move quickly. And so that's also a hesitation that I have with having another entity inside our school.
I just, I want the board to express whatever concerns or thoughts they have, but I just, and I'm still sifting through all this information and this data, but I'm looking at this I'm playing the long game here on what this could look like down the road, for our students and for our parents and our community. I think there's a lot of good things that come from it, and then there's just other things that I need to get sorted out. Around that, and looking at, is there possibilities for helping more of our students with mental health needs rather than there being one clinic in one school? Is there ways that I'm more concerned, or really concerned, that children at our middle school level and even our upper elementary, like 4th and 5th grade levels, that are dysregulated, and they're, what help are we able to give them before they get to high school so they know how to function and work through behavior and mental health issues? I would like to just see if there's a way that this conversation could become bigger to help more of our students with the areas that are highly impacted. Because we know that the mental and behavioral health is a huge concern, just from what we hear from our teachers, and from what we hear from students as well. And we obviously see it in the numbers with the clinic. And so I just wonder if we need to think bigger, rather than just one clinic in one school. Is there a way that is something that's maybe more mobile that could help students and their families? I'd like to start, Will and I, I sit on the behavioral health committee that the county puts on, and Mind Springs is on a good track. They're working through some good things with new leadership, and then Director Jones is going to start going with me. But I just wonder if there's a way that we could just start looking at other opportunities to help, help our students and families. So I'm just putting
I
that more
agree.
out there.
As we were, a couple of meetings ago, Patty came in and did a presentation, regarding what kind of staff we have to handle those kinds of issues, and it seemed pretty light to me. And we know that these problems don't start in high school. And we know that there are issues with our middle school students. And I agree, I think maybe something broader where we could move it around and go to wherever the need is the greatest. I think this was an idea that hatched based on what all was going on at the time, but maybe there is a way to, like you say, think broader, think bigger, and make it more accessible for those that want to use those services.
I think that that's a great idea, and I think we should definitely explore that. I also don't see that as a reason to not move forward with this really great opportunity to serve, over 1,000 or 2,000 students in their medical and behavioral health and dental needs each year. And again, I know that the assessment was done in 2018, but I don't think anybody in this room thinks that needs have decreased since 2018.
Yeah, it's, and I think great points. and if we go back even to 18, is, what is the end goal for the district? Why a clinic? Why do we do the things we do, right? Why do we provide busing? Why do we provide lunches for kids? Why do we do a lot of the things we do? It's to have a certain outcome, and that is academic success, all those things with that. And that was the target of the clinic at Central and proposed at Junction. And it's, what is the old saying? Good is the enemy of great, or something like that? Is if there's, you don't want to miss opportunities to help, recognizing there may be other better ways to do it, but if you wait till you have the best, you will just never get anything done, and those services won't ever be rendered for kids or community. So it's that balancing act of looking outside the box. Like you said, are there other avenues, other delivery systems to address this, not just through the district, but through the county and the city, or cooperatively? But in the meantime, there are the fires raging at our schools, right? At middle, we talked about middle schools and maybe upper elementary, and what are some strategies, what are some resources we have that could meet those needs? And so, our decision, I look at it, the purpose of tonight is, okay, what is it that we're trying to decide upon? And it seems like we're trying to find what are the resources that are available to our students to have good outcomes personally, and success in their learning, and success as being young people. And what is the most effective way of doing that? And, a couple of years ago, the clinic was I don't think it was viewed as an end-all, that's going to fix everything, but it's a step in the right direction. So I'd hate to see us get lost in the weeds and look at what can we do to continue that momentum, and yet not just say that it's all done and this is how it's going to be, because I think you're right. There's other things we can look at, and how do we maximize, the concern, how do we address the concerns people have about, no one's out to undermine parents. It's never the goal here. Like, by the way, we want to undermine parent permission. That's, no one ever does that. It happens, I guess, right? But that's not the goal. So how do we minimize that, or eliminate that, and still provide the services that are needed? There can be a win-win all across the board, and so that's what we have to look for.
So
Does that make sense?
When we agreed to build Junction, was this brought up in?
Oh, before that was ever on the bond, the plan at that time was, after the presentations, was the recognition that this is a useful tool to help our students at Central, Junction, and, from a personal angle, I thought, why, how are our kids at Fruita or Palisade any different? They have those needs too, but it was a good starting point. That was the highest temperature at that point that needed to be addressed. But yeah, I think the plan from the previous board was this would be a useful resource for our kids at Junction. That was 4 years ago. And to your point, we got to look long term, and just because 4 years ago that was determined, maybe it isn't today. And it'd be interesting to hear more from the Central community, not just the student survey, but parent survey, and are getting outcomes that everybody had hoped for. We know how many are getting services, but are we getting the outcomes we want to? Are people feeling it's a good reflective point to see, is this really working the way we wanted it to work? And if not, how do we fix it, or do we scrap it, or do we say this is great and let's continue? So I think it needs constant evaluation of, as President Heights mentioned in the memorandum of understanding, it is that was supposed to be built in, and for various reasons is maybe not there. So anyway, hope that all made sense.
I think personally, I think the communication just can be better between all parties. I think that it tends to get lost with certain things, and there's an understanding that our youth are getting abortions at the school, and we're not telling the parents, or they're getting A, B, or C. But if we don't have that continued open dialogue, that the parents don't understand what's going on, we don't know what's going on, and it's kind of like then we're being sneaky. We're trying to sneak this in. So I think that the communication is a lot better between all parties, that it definitely could help relieve a lot of that stress, a lot of that tension. And we also let the parents know that they're still, this their children are still in charge, but we just need to figure out a better way of doing that, in my opinion.
No, I don't disagree with that at all. So, anyway, so I think the questions, we've thrown some questions out that I think we still need answers to help decide, what the future will look like at Junction or not.
I think that, so the clinic at Junction is not open to the public, correct? The clinic at Central is not open to the public, just students and staff, correct? Okay. So, okay, so that leads to, I think, facilities and FCI is, if the board, or whatever, if it changes from the clinic, what is that gonna look like cost-wise? With that space that, it's almost 1,500 square feet. So there's been, I don't know, and maybe I've misheard, but if we don't move forward with it being a clinic, what does that look like as far as expense or what? Do you have a question? No, go for it. Can one of you guys come up and? I know, I don't think it's volunteered. I think they're voluntold to come up.
Can I, right before, that just reminded me of a question that I had, like just the framing of this to get to that question. So this is a fascinating conversation. I love hearing about what all we've done and what has been done. And again, it sounds like there's, 500 to 1,000 medical service appointments provided, 500 to 1,000 mental health service appointments, dozens of dental appointments. I guess in my mind, and again, there's no medical services rendered without parental consent, except for in the case of an extreme emergency. Like, I can't wrap my head around all of that and getting to no clinic. I can't sort how that would even be on the table right now.
Well, I think it's gonna end up being a board decision, so I don't know which way the board would vote. So what I'm trying to do is just make sure that the board has all the information possible, because one little thing may influence the other. So, I think it'd be foolish of us to just say it's okay to move forward without have brought the community along in the conversation, especially with other things that we know we're gonna have to ask the community for. So I just, since a lot has happened and people are now kind of re-engaging, I think it's time to bring a lot of people, and a lot of people are interested in the school district, to bring them along in this conversation. So I don't know what the board will wanna decide, so that's why I just wanna put everything on the table, so to speak.
I
I
guess,
think we're talking about two different things here with FCI and the contract. We're looking at, we have space that was built into the budget for this project that was voted on and passed. And that space at the time of the bond election was envisioned to be a clinic. Now, 3 years from now, 5 years from now, boards may decide or schools may decide we want it to be a bike shop or whatever it may be, right? But we want to make sure that, to honor what was initially approved for a clinic, that the infrastructure is there for that or whatever we want it to be down the road. That's at least where I'm coming from, that we haven't taken the space away, right, for whatever we use it for, and that the infrastructure is there for, if we as a board vote to have a clinic, or we vote to have whatever we may have, in that space.
And I think we
That
can.
make sense?
Yeah, and I think we can rest assured that the space is available. We've earmarked the space. We had a discussion this last week. The drop dead date is really March 1st timeline. Does that sound right?
Yeah.
March 1st, we just need to know.
Okay.
So we can pour concrete and get everything else done in that space that we need to. To talk to the question of what do we do with the space if it's not a health clinic. There's been some other things that have been thrown out, the haberdashery, some kind of an area that people can come to get services for clothing, that kind of a thing. But right now, the space has been earmarked for the clinic. I mean, that's what it shows on the drawings right now. I think that was,
So
is that correct?
yeah, the current space is a big box, basically. So that's what's currently in the contract, if you will. And then the clinic, if you add the clinic, that would be added cost to the project.
So that wasn't figured in the cost to begin with?
It's on the add-on.
It's an add, okay.
Yes.
It was an add-all, yeah,
Add-all.
yeah.
Could
yeah.
you, just for our community, could somebody just explain what the add alternate or add alt is?
Go ahead.
Yeah, so, things like the clinic were easy things to price and put on a we might do it later list.
Okay.
And so we put it on an add alternate list, which we price it up, we have a full cost for it, and then we identify things like that we can add at any point through the project, with minimal impact to us. And so, that's why we put it on that list so that this decision could be, made,
So if by
yeah.
March 1st, you need to know, is it going to be a clinic or not a clinic? Let's say hypothetically, it's not a clinic. But then 5 years from now, whatever may come around, they want it to be a clinic. What I'm suggesting, would it be easy to transfer that, or would it be?
Pretty easy. Yeah, no, pretty easy, because we are stubbing in the plumbing, the underground plumbing, so that if it ever turns into a clinic, it'd be some pretty easy concrete cuts and put the plumbing where you need it and add walls and divide the space up into whatever you need. So it's
So it sounds like the space can be, over the decades that building's going to be in place,
Yeah.
will have flexibility to be used,
Yeah.
whatever.
The infrastructure will be in place to do whatever we need to in the space. I will add, though, that there obviously is a cost to renovating a space. So whatever that is, health clinic or classroom or whatever it is, there's a cost associated with that.
So the cost isn't specific to the health clinic, it would be no matter what we make.
It doesn't matter, yeah.
Right now, it's just a box.
It's just a
Right.
box, right,
However you want
right.
it to, okay.
Yeah, so there's no extra money being spent, to make it a box or to make it, it won't cost any more to make it a clinic if the decision's made in a timely fashion. There will be there's no premium to that added. So this decision being made now has no impact cost-wise. It's just a straight one-for-one. That's what it costs. There's no-
Perfect,
Does that make
thank you.
sense?
I think that was one of the questions I had was, are we making a significant change? I think there was questions whether it was original plan or add alternate. So I do appreciate the clarification as far as that goes. And then, and then kind of just knowing if this ends up becoming a board vote or decision, what time frame does the board have to kind of make those decisions concerning that?
Mark, do you remember what the cost was on the adult list?
I knew you were going to ask.
I knew,
I
I
know.
should have, I
For
should have
for the furnishings, for the finishings and furnishing was 240.
240.
That sounds,
Sounds right,
that
yeah.
sounds right, yeah.
I didn't dare.
But even our
Wanna make you
MOU
do
with
it.
Central put Miralac in charge of that. So while it was aspirational to have it in there, I think makes sense that it was an adult and that it's not.
Right, we want to make sure we got the design correct, right? You don't want to build it and then it not, fit the needs if that's what it ends up being. So, like I said, we're in a very good spot right now.
So, so that leads to another question I'm going to have, and maybe other parents have, is, that's almost 1,500 square feet inside of a school that we're very much changing up how that school is going to run because our teachers there don't actually have dedicated classrooms. So then, question I have is, what if all of a sudden we need space in that school for educators or something else that comes up, but then we don't have it? Because, again, this is all in theory, and I know there's other schools that run this way, but it just makes me think, do you just wait because you don't know what you need that space for, which I know we may not have that luxury. But these are the questions that then kind of end up popping up in my mind because Junction's going to run very differently than we've ever had before, like any other school before. So, I mean, I know it'll be maybe like a college campus where, you're going to different classrooms, but I don't know. They're just concerns or questions that I have on kind of operations too.
So that sounds like it's was the building designed properly question?
Well, no, I just wonder, since I believe if I remember how the plans look, there will be spaces for teachers to basically land. They can sit down, do planning, or have spaces where the teachers will be at. But because they don't have dedicated classrooms where they'll be having, all their items set up like it's, their space, I just wonder, would the school need about 1,500 square feet for something that is unforeseeable to us? I don't even know what issues could arise.
So Andrea, that question did come up.
Did it?
I did
Okay,
pose
good.
that question at an OIC meeting, at a couple of the meetings, and the principal there indicated that they could definitely use the space, was, I believe, an exact quote. We could definitely use the space.
Okay.
So, we can dig into that a little bit more if we need to, or whatnot.
I guess I just want to know what the options are and maybe what other people are, seeing it through, people who are going to be in that building, day in and day out, and maybe what constraints they already feel that they have. So I would love that feedback of what they might foresee being a challenge with it changing up. So I do want to make sure that I don't want to drag our feet on it because we do need to be able to make decisions moving forward that would not end up costing, the district.
Just in response to that is the original, and I'm just going back to the previous board, when the original design came out, and this is my recollection, you can ask previous board members, but that space was not in the original design, and there were a lot of meetings about how the building should be designed and laid out, and space needed for this, and that, right? And so that gets back to Carrie's question about, was the original design not done properly? This space was an add-on purposely. We went back and said, that previous board desired to have that space earmarked for a clinic. And that was added then on to the ask of the community in the bond election. So, from where I sit, I kind of looked, again, things have changed, but that was the intent of that add-on, and the extra dollars that we added on to the ask of the community was for that clinic.
So did we add total space to the building, the size of
Yes.
the footprint?
Yes.
Got
I don't know, the
larger just to add the clinic? It wasn't an interior moving around?
No.
We actually made the building larger to make sure we could accommodate a
Yes.
clinic.
Yes.
Okay.
Was the clinic specified in the bond language, or it was just?
It wasn't specified in the bond language. We've looked. It may have been the intention, but it was not in the bond language, so
Yeah, there wasn't in
therefore
the
it's not a
language on the
requirement.
ballot.
We have decision to make.
I mean, I would say that, it's not like the stairwell was in the bond language, like specific rooms would not be.
And to the point, Angela, listen, as a building principal, you can always have more space, right? So if we as a board decide, or 5 years from now decide, or 10 years, want to change anything in a building and the use of it, that space can be used for something different, right? And because you can always have more space. The reason the space was finally determined what it was, I remember we had to cut out, if I remember, tens of thousands of square feet from the original design of that building because of cost, and we wanted to have it under a certain, and that transmitted into cutting square footage, right, from the original aspirational goal, what we wanted the building to be like. All my point is that it doesn't surprise me, a building principal say, yeah, I can always use that space. Anyone could use that space. Our decision isn't based on what a particular principal feels they could use that space. It's to determine, do we feel a clinic, a health clinic, will benefit the needs of our students, whatever space is used, right? If you bring in a modular or whatever you want to bring in, that it's designed to help our students perform better in their school and be successful. So, does that make sense? You know, I'm not arguing any point one way or the other. I'm just, I think the space is there. That's kind of what we want to make sure that it's there for whatever it's used for.
Just to clean up on the square foot space.
Sure.
For clarity, and that is, there was a target square foot space. That square footage, through design, it happens a lot. It just grows. And then it was reduced back to the target square foot space. So what was originally planned square footage is what we have. So,
I thought on the plan it said like, it was like 1,400, I mean, I literally, the plan that we were sent, whatever's on there is just, it's just under 1,500 square feet.
what's the total square footage?
I think it was 242.
249, I think.
But I remember it started out close to 270. When we first started, it was at about 270. I don't know, Eddie, do you remember that? Pardon me?
It was 259, I think. We ended up with a target that through design, it grew, and then we got it back to where the target was. So from the
To
very
meet the budget.
beginning, we're right, yeah,
To me, what we wanted to ask.
right,
that- yeah, so,
right, just for clarity, just to make sure.
Thank you.
That's great.
And Mariah does confirm that that space was added specifically for the health clinic.
That's
Yeah, I guess my only concern is, and I voted for Grand Junction High School, and I think establishing a clinic in a high school is different than saying we're gonna have stairwells in a high school. I mean, I understand that you don't tell the voters every little thing, but something like, I mean, we had lots of discussions around a balcony, we've had lots of discussions around gyms, we have a lot of discussion around this auxiliary gym that we decided to keep, which that'll be another discussion down the road. I think it bothers me actually that if we did not make that clear to the voters.
Clear.
I mean, that is just kind of why I'm advocating so much to bring the community along in the decision now, because I don't want it to look like they got hoodwinked by the district. I feel like we're doing a really good job, this board and our staff and admin, to create a lot more trust that has been eroded away for lots of various reasons, right? It's just been contentious the last couple of years for everyone. Everyone's lives have been turned upside down. And I just don't want I don't want to take all that trust and erode it away because they think, well, it was just in there and that's just what we did. Because it frustrates me to think that a clinic was proposed, but I don't know how clear it was to the public. I mean, I did not know about that when I voted for it, so. I mean, and I'm not casting blame on anybody and my responsibility was probably to ask the board at the time more questions, but that's what I'm just saying, a clinic is different than a lot of other things when we're asking parents, send your kids to school and trust them with us, with what we're doing. And I just want to make sure that we are still moving forward with that healing that we need in our community, with the trust between our community and the district. So that's just, I just feel a lot of responsibility around that personally.
Absolutely.
So,
And I think moving forward, if this rendition of the Board of Education were to move into doing another building or anything that's that large a commitment and investment from our community, that I would want those kinds of things very much specified, at the risk of maybe not getting a bond passed, but to be very specific with the community and transparent with them.
I do want to add that the board did pass a resolution about this as well. So like it was very.
I mean, with part of the
What I
bond
was gonna
language
say
where it
is-
comes down to
is-
the vote.
Liz, and Will said this, we can never communicate enough, and obviously, if one person didn't understand it, then we didn't communicate that enough. But when we did, when the clinic, and again, this is my recollection of everything, when we had the clinic at Central, it was clear, it was board discussion, public discussion, that the intent would be Junction would be the next school to have that. Now, in the bond, that wasn't, that wasn't communicated as well as it could have been, as maybe other things should have been communicated too. But you're right, as we are today, right, that's history, you're absolutely right. Whatever we do, we don't want to set up anybody for failure. The school, the staff, Marillac, the district, the future boards, we want people, and again, understand, not everyone's going to buy into whatever we do, if we have one or not have one, but to be very thorough and transparent about, if we do have it or don't have it, it's what our reasoning and logic is behind that decision.
Dr. Jones, did you have something?
Um,
Thank
So-
you, Clint. Thank you, Mark.
Thanks.
I know you guys are ran by grants, right? It's funded by grants, is how you run the Maryland Clinic, right?
And billing, yeah, there's quite a
So-
lot of Medicaid billing.
So then my question would be, is it just for, is it a way to open it up for families and students, or just, is it just student-based?
That is a choice of the planning and advisory committee. The advisory committee that planned for Central decided not to open it to the community, and there was one main reason, is because there was no external access into the clinic. But there are school-based health centers, as Brian mentioned. So what they do in the summer, all year round, they open it up for families, or they open it up to the community, they open it up to the rest of the school district. That call or that choice comes from the school district as to what you really want.
'Cause I think a lot of that, a lot of the frustration is, it's great from August to June. But what happens in July when school's out and these students go home? If they're not seniors, they're sophomores, freshmen, what happens then? Then you're stuck, trying to find healthcare. Or if it goes deeper than just, if it's a mental health issue, if it's just the son, but we don't know if he's having his health issues because he's having problems at home. So why not be able to extend those to the families at home to be able to go in and get counseling in the home, or have them come to the school and have a center? I would be more apt to be more comfortable if we opened it up to the families and it's not just an 8 to 5 or a 9 to 4 or whatever it is type of thing. I just didn't know if that was the way it was set up, designed that way, or if it was a possibility to open it up to.
As a community health center for us, our vision is always to serve the entire family. So we are very open to that concept depending on the physical layout of the clinic, whether there's external access. And when the school is closed, I just wanted the school board to know that the kids have access to us all through the year. They may have to come to another facility because the school is closed, but we are always available.
That makes it more difficult for you to
Because
do
they
it in
are
summertime.
registered patients, and that is our commitment.
Okay. Thank you.
So just to clarify, remember, Central didn't have any way to secure the rest of the building down for that to be an option. I think when I went to the one meeting for the design of the new school, there is an exterior and interior entrance from how it was designed. So
I think we also need to consider school safety and the idea that we've got this thing locked down for a reason with not letting the public come in and use the school facility and not just have access to it. I think we have to be really mindful about I understand totally what you're saying, and I agree when we're looking at behavioral stuff, how often do we really need to see more than just the student? We need to see family members with them or family members in addition. But if we're allowing the public to just come in and use that as a separate kind of facility, that would, I would piggyback that on my suggestion that we maybe put a clinic very, very close, in close proximity to a school, but not inside the school. And sort of muddy up those waters between what is school and what is the clinic?
Yeah, we had gotten a few emails around parental concern that they thought the clinics were open to the public, and how were people getting into the school and the school still staying safe, which that is not happening. We don't have public access to the clinic.
And now what kind of, if we allow people access from the outside to come in, now what kind of safety do we have between people gaining access from the outside into that space and they're, again, having access into the internal part of the school? That, I think, would be
Right, those would need,
pretty interesting logistics to get through, to make sure that the inside of that our school can remain safe and can be hardened if necessary.
So Mark and Eddie, would that be, and again, we're talking step 300, and we're talking step 1, but is that something with the outside exit, just like we do in our main building, there is, an entranceway and a security vestibule, and people check out who they are, would that still be a possibility? If that's how everybody decides to go, to expand the reach, can that be done? Or was that thought of as
at Junction,
At Junction.
can you do an exterior entrance that would be secure to the clinic?
or was that considered in the design?
Thanks.
Okay, so just so people at home, it's not currently in the design. It could be, to obviously make it more robust, to be secure for, I think, what our requirements are for security.
Then we're going to have security on the other end of it as
Exactly.
well.
So I kind of want to just recap, because I think we have some action items, right? Some things that I know the board needs follow-up information on. So Marilak's going to get us some more information on some of those reproductive services, kind of what the list of those are. We wanted to know too what, I'm sorry, did somebody keep a list? I should have.
Well, this is what I wrote down. I wrote down the survey results from the principal that were
Yes,
given to
thank you.
students, and then it sounds like possibly if there wasn't a parent survey that the board might request that, but if we don't have that data right now, then that'd be something we'd have to get. So, but at least the data that the principal received, and then I think there was a question around like district level oversight of what's going on at the clinic, so I can get clarification on that. But then I think there was a question from Marilak specifically around the reproductive health.
Yes, and then Mr. Levinson had asked for the delineation of the services that are provided that do not require parental consent, just kind of what percentage that looked like, because then obviously everything else requires parental consent. I think that information would be helpful. Board, is there any other questions or thoughts, comments that?
Well, I don't know if even if I have my thoughts clear on this, but what is it that each of us need to know to help make the decision? Because again, we're getting influenced by others that we need to vote yay or nay on that, clinic or no clinic. What is it that we each need to learn about that can help solidify the decision and the rationale behind that decision? Does that make sense?
Yeah. I know for me, I need to go back and find where I found information, for instance, in California where parents were not being, or parents were not giving their consent. And I need to find out for whether that was a district or administrative issue, because again, what I'm saying is I want to get out ahead of something and think of a long-term game, because if it's something that does move forward, then what do we need to do as a district to ensure that that doesn't happen here? So I will do some investigating on I need that comfort level of knowing that we're always keeping the parent informed on what our obligations are per state law. So, and if those laws were to change, what does that look like? So,
You know, I guess for me, and I brought up some, is that, for lack of another term, that customer satisfaction information, you know, with all the interventions that have been done, have they borne the fruit we had hoped they would with student performance, student wellness, those kinds of attendance, you know, just the things, the outcomes that were the best hopes at the time at Central. I'm picking on Central. I know there's other data places, you know, other schools that have it in our district, you know, have those outcomes been reached? That would be one. Yeah.
yeah, that's good information.
Think of-
So I think we can get data on satisfaction from the services. I'm not sure you're gonna be able to pinpoint data that says, because the school-based health center went in there in 2020, especially through everything that's happened in the last couple of years, that attendance was changed or that academic performance was changed. Like, I'm just putting that out there. I don't think we're gonna be able to get you that. We can probably get, or we can get, the feedback from Lance's survey that ideally would be, I don't know what those questions were, but it would be asking the families at the school, or the students at the school, in this case, did they feel like that the services met their needs? We could get that, but you're not gonna get data that says
And that's fine,
attendance went
that's
up
fine.
because of it.
And I'm not, the other thing that occurred to me is, you know, I'm looking at what are the issues. I think as I've listened to all of our board and many in the community, I think there's consensus that there are needs out there, and probably even greater than the needs that were there 4 years ago. So if we go with that, and maybe not everybody feels that way, but I sense that we have a baseline that we agree with that none of us are saying that we don't want to provide a service. We're questioning, maybe, is this the most effective and efficient and service that we can provide, with some of the caveats that are frustrating for people, the parent permission thing perhaps, or the cost, which we have minimal cost with, and I know. But to explore what would be some other options. One came up, I know we have to follow the state law, I guess, but are there, I mean, Tammy's not here, but are there ways around that to still provide, I hate to throw out everything because of one thing that may not sit well with people, right? You hate to throw out everything, baby with the bathwater, when, you know, most of it's working or is effective. And are there go-arounds to get, for example, I'm not saying this is a major one, the parent permission thing, right? That to get a service that we,
Can I just
yeah,
say,
sure.
parent permission is required for every medical service, and there's not,
Okay.
that's period. There's some behavioral health services that they're figuring out what hasn't had.
Is that that's accurate, right, or not?
You know, we've got to also think about, you know, Andrea uses the analogy, putting the toothpaste back in the tube. Today, they're doing that, but not only will they have to, but will they be able to?
It's in our memorandum of understanding, so we can put that in a memorandum of understanding.
And that's going to trump if state law changes.
That's a great question. I'm not a lawyer.
Yeah.
But that can be part of our, you know, and we can put in our memorandum of understanding is that, like, if things change in a way that invalidates the memorandum of understanding,
So
it needs to be revisited.
Andrea and I had a meeting with, I think all of you guys were there, several months ago. I think it was warm. And you had mentioned that, correct me where I may be paraphrasing a little bit too much, that under the conditions of your grant and, I believe, state law, that we really couldn't pick and choose which services you would offer. It had to be everything that was in the grant language, or maybe it was also CDPHE. That was maybe the state health department, about what they required a school-based. Mm-hmm.
the core services, but there is a way, an option for a school-based health center to refer out for some services. So if that's not cherry picking, you're still offering the services, but
So, no, okay, go ahead, I didn't mean to interrupt you. So, that just brings another question of mine that I brought it up at the last meeting, but I'm going to do it again tonight. I'm a big proponent of choice, whether it's parental choice, choice in healthcare, choice in services. And so with the referring, it sort of feels like we're putting all of our eggs into one basket. I don't know how it all came to be that it's Marillac as an organization, but in those referrals, I like the idea of giving parents and students a choice in saying, you could go here or you could go here for these kinds of services. I think when it comes down to healthcare services, I like the idea that people have choice. So again, if we were to do a referral process or something like that, I think we'd have to get really specific about how that would happen.
Kay, what were you going to, did you have an example that you were going to share? What did that look like?
I would say that if reproductive health services is something that you don't want provided on site, I'm obligated to provide it because I am the person who runs the school-based health center, but I can refer the kid out of the site, either to one of our main sites or to the health department or to any other referral. And if there's minor consent, then we will just have to work around that, but we cannot remove that service completely. So if a kid walks in and says, this is the service I need among your menu of services, either provide it on site or give them a pretty firm referral that is like a really strong, warm handoff so that they get to that other place.
So you don't deny the service, you're saying, we can't, again, a hypothetical, we can't provide that here, but you can get it.
Right, I mean, I just really want to get specific on an example. If somebody came in and said, I want to be on depot, right? We don't have to do that at the site on the grounds. We can write a referral and say, here are your options to go get that done. Does that help?
Yeah, and one of the lists on that referral could be one of our sites and any other site like the health department, because we have a very close relationship.
I would be curious for things like that if we're starting to, do à la carte services. I would want to understand, do we have any information about that specifically impacting teen pregnancy rates if they, don't have those services on site or whatever?
I would say that school-based health center data in general, the national level, will say that providing the service on site gives you better outcomes.
I wonder, is it okay if I speak about your question, Angela, on choice? You come up and, oh, sure.
Just do it in the mic so that it's for the public.
Just quickly, when you talked about choice, and yes, that's important to us too. And the whole model of school-based health centers is not to take away care by their primary care physician or somewhere where they're already established. That's not the point of it. The point is to be able to almost like be an arm or a support of that. And that's why we had physicians and pediatricians on our planning committee so that that was understood. And it was part of the FAQ that I think is even still posted, on the Healthy Schools website, that we help coordinate the care. So if you came in or your child came in, had something acute right then that we could take care of, it's not to say we're going to take over your care now forever. We're going to say, follow up with your primary care physician. Or if it's a chronic condition, follow up with your chronic care or with your primary care physician. It's helpful for those families that don't have access to care, uninsured families, maybe have never had a medical home or a dental home, that we can be an option for them. So it's there for them if they want to make it their medical home. But it's not to replace their primary care physician. It's to be an arm, an extension, a support of that.
Thank you.
Dr. Hill, could you bring up slide again, it's cutting off on mine of just what is the minor consent at what age. So, because the questions I have around this is, you know, you've got outpatient mental health services. And I know, so the minor can consent to that, they want care for that also for if they're a victim of sexual abuse. And then substance abuse disorder, I don't know, it kind of cuts, yeah, and then, yeah, thank you. So I guess my question is, you know, and I appreciate Dr. Schulte's making sure we're staying clear on what parents are getting consent on. But I mean, if there's, I get concerned, you know, can you only tell the parent if the minor tells you that if they're having a mental health issue, if they don't want the parent to be told, or substance abuse? Because I guess then I wonder, are the families getting engaged in helping the student through this crisis? I mean, I understand some families are why kids have the crisis, but what is happening if, like, you know, being a parent, I would want to be able to come in and help support my child if there was this issue. And granted that, you know, being a mother of teenagers, they don't always want to tell you everything. So I appreciate that they have friends or other people they can talk to, but then it just concerns me from the parent standpoint, like, how can the parent then support their child? So can only a parent know that a child accessed that if the child gives the healthcare provider permission to disclose it to the parents? Okay, that's my understanding, is that right, that's for any healthcare provider. That's not just Marillac. I appreciate you guys answering our questions, and I don't want people to think I'm picking on Marillac, but I just want an understanding of the Colorado law.
So the parent may give a general, sign a general consent form saying, yeah, if my kid needs to do whatever at the healthcare clinic, that's fine. But if, you know, if the parent is thinking, well, they would use it for maybe the sports physical or one of those things, but really the student ends up using it for one of the other things, the parent would not know that they came in. Thank you.
If the kid chooses to. I will tell you.
The student's right to decide whether or not the parent would be brought into the conversation.
As an organization, we encourage every student to talk to their parents, and I can tell you, we document very well that we had those conversations, saying, hey, we really need you to talk to your parents. But at the end of the day, it's the child's choice.
Got it. Right.
Right.
Thank you.
Yeah, you have to adhere to the law. And just for those who might not have heard, Marillac says that they very strongly encourage the students to speak to their families about it, but again, by law. So, you know, I don't agree with the law. I'm just gonna say personally as a parent, I don't like it. But, you know, it is the law. So that does kind of tie the hands of physicians, obviously puts, you know, the school district, we don't control that part of it, nor does Marillac control that part of it. So I think it's just a matter of how do we navigate through some of these things to make sure that as far as it's up to us, we do keep parents at the center of that. And I do appreciate that you guys are advocating and telling students to do that. If any of these require medication, though, to treat an infection, those can be administered then to the student if it's like a sexually transmitted infection?
We don't prescribe, like, we don't dispense.
Okay, you don't dispense of those. Okay,
We have contracted pharmacists.
okay,
We write the prescription.
And they will be entitled, if they are not Medicaid patients, to a substantial discount.
okay. But that is one, I think, just for clarity, a student can get a medication without parental consent because it falls under this minor consent.
Not for all medical services, though.
Okay,
So remember, if your kid comes in and you're putting them on antibiotics because they have a chest cold, that is definitely under parental consent.
Right. Right. What I just want to clarify is that some of these do actually require a medical treatment, like a medication. Okay, right. I'm not saying whether, you know, we're not saying that all medical services require parental consent, because there are these that are minor consent, and a medication or a treatment could accompany whatever that need, or whatever needs to be done for the student, correct? Okay, you don't stock them, you don't dispense them. You write the script for them, and the student then goes and seeks out attaining. Yeah. Right. Just like when I go to my doctor, yeah, exactly. Yep, no, understood. I just am trying to bring clarity. I know a lot of, well, at least before becoming a school board member, it was a lot of understanding from the parental view that the school board doesn't have any say in this, because this is state law when it's, you know, when it comes to this age with the children, so I just. Well, right, no, because the law will always, I mean, my understanding is the law is always going to trump a policy, a procedure, or an MOU. And we can ask Tammy that, but it's the law, so I don't see how you could.
I would like her to answer that for everybody. I did talk to her about that, and I believe you're correct.
Okay, well, yeah,
But I would like Tammy to
I'm not an
give that
attorney,
an-
but we'll
Yeah,
let her.
I'd like Tammy to just give that answer.
Board, was there any other items on our list that we wanted to investigate? So, okay. Well, personally, I have some things I want to look at. Obviously, we'll then see what we can get from the principal. Marillac will get us a couple different data points, and then if board, if you think of anything else, we can email those so that we can get the information. And
So is the plan next meeting, or is that too tight a time?
I don't know, because our next meeting is Tuesday. We have a pretty packed agenda with our business meeting. So potentially, yeah, the work session, if needs be, or if we have to do something before that. If we're able to get the information for the meeting on Tuesday, we could see if it wouldn't take long to present that, to make sure that the board can have that information. So if we have it, I'd say we could probably add
Well,
that.
we have time to.
I don't know that we're I wouldn't say, unless the board is ready, I wouldn't, if this is looking like it needs to be a vote, I don't know that I'd feel personally ready by Tuesday to make a vote on it. So I want to make sure everybody feels like they've had time to digest the information before doing any kind of vote. So it could be discussion items on Tuesday, but no vote.
If we could get the information, say, by the end of the month, then we can have a vote then following in February. Because you're right, you want to sit on that information and see if it prompts new questions.
Yeah.
Well, and we want adequate time for our community to reach out as well.
Correct. Any other? All right, well, thank you, everybody. Thank you for Marillac and our other staff that came out, and FCI, to answer our questions. Thank you, community members, for coming. If you need to catch any of us afterwards, if you want to relay any questions, or you're welcome to email us as well, as we're taking in all that feedback during this time. Thank you, everyone.